Hi, I'm Tamara New. I'm Dr. Tamara New. I'm the director of the Comprehensive Sickle Cell Program here at JohnsHopkinsAllChildren'sHospital. Today we're going to talk about some common misconceptions about sickle cell disease. First misconception that I think a lot of people believe is that sickle cell anemia only affects individuals who are African American. It does predominantly affect individuals who are African American or of Latin American descent, but also individuals who have Mediterranean descent, and of course, individuals who are biracial or multiracial. We can see sickle cell disease in those populations as well. Another common misconception that we see with sickle cell disease is that all patients have pain all the time. Many of my patients will have periods of pain. Some periods of pain may be worse than others. And so I have some patients who have to be hospitalized for every pain episode that they have. But I have many patients that actually don't have to be hospitalized most of the time when they have pain. They're actually able to treat their pain at home. Another common misconception about sickle cell is that all of my patients are drug seeking. That is one of the most disturbing misconceptions about this disorder. And it's one of the reasons why I continue to be so passionate about taking care of patients with sickle cell. My patients do have periodic pain, but most of them try to stay out of the hospital. This can change over their lifetime. And if you can imagine that you have a disease that you think you have it under control, you think you know what works, and all of a sudden it flips on you and it changes. And that can happen for some of our patients as they go through puberty, or maybe even when they get older, as they go through other parts of their life. They can have other stressors that just make their pain respond differently to medications. But patients can start developing pain at a very young age, even from 6 or 8 months of age. So you can imagine that that can change over time. But it does not mean that every time they come to the hospital, they want to stay in the hospital. Most of my patients really do not want to be there when they come to the hospital. They'd rather be able to get something that gets them feeling better so that they can get back to their lives. And I try to encourage them to speak up and know what works for them so that it can help expedite them getting out of the hospital and not staying longer than needed. So when I meet our families here, we tell them we're their team, we're a part of their family. We'll walk them through this journey. I met a new family yesterday, and the family was a little tearful because they recognize that this is a lifelong disease. There are challenges, but you are not alone.